Come in.
Hi, Julio. My name is Dr. Perez.
Hey.
How's it going?
Not bad.
Okay, nice to see you today. Before we get started, can I just have you confirm your name and date of birth for me?
Sure. Julio, January 3rd, 1990.
Very good, thank you. So as we go along, I'm just going to be taking some notes here.
Okay.
So tell me a little bit about what's going on. What brings you into the office today?
I'm just having some issues with my elbow. It's kind of sore. Sometimes it feels like I don't have any feeling in it.
Got it. And that's going to be this side here?
Yes.
Okay. So it sounds like we're having some loss in sensation. How long would you say it's been since you started to notice these symptoms?
It's been about a week or so now, but these last few days I'm really feeling it.
Okay, so kind of progressive loss. It's not really something that you noticed happening overnight. It kind of got gradually worse as the week progressed,
right.
Correct? Okay. And would you say you've noticed a difference in your ability to sense hot and cold, or is it just the sensation loss?
It's just a sensation.
Okay. Have you recently had a fall or any kind of head injury or blow to the head, concussion?
No.
No? Okay, very good. What about anything that might have compromised the affected area, like maybe a scrape or a burn?
No, I don't think so.
No chemical burns? You're not using any kind of new body wash or anything?
No, same body wash.
This is Bruce, right? I saw on your chart that you were bringing your emotional support cat.
Yes.
Nice to meet you.
He goes everywhere with me.
Okay, that's great. And aside from the loss in sensation, are you having any tingling or pins and needles? Kind of static?
When I wake up, it does still feel like my arms asleep, and it takes longer for the elbow part to wake up.
Okay, and that is also isolated to like the inner elbow area?
Yeah, for sure on the inner side.
Okay. Okay. Do you ever feel like that radiates up towards your heart or kind of down towards your wrist, or it always just stays
No,
stagnant?
it's just in the elbow.
Okay, good. And let me just take a couple of notes here. I just want to make sure we're keeping up. And moving forward, I just have a couple more questions, and they're mostly about like family history.
Okay.
So do you have a history of diabetes?
No.
And what about anyone in your immediate family, like your parents or grandparents?
No.
Okay. What about a history of neuropathy?
No.
No. Okay. And lastly, a history of bone cancer?
Nope.
Very good. Okay. So it does look like we need to perform an in-depth sensory exam today.
Okay.
Just to rule out a couple of things here. Before we get started, I am going to just wash my hands quickly and ask that you do the same. Is that okay?
That's fine.
Okay, let me just pull our supplies over here. So just rub your hands together for me. Thank you. Okay, so let's go ahead and get started. I am going to get your blood pressure bilaterally today.
Okay.
Normally we would just take it on one side, but it is important that we get it on both sides because I do want to rule out any lack of blood flow on one side or the other, okay?
Okay.
I'll start on your unaffected side. Just rest your arm down for me. And relax. Okay, 171/98. It is a little bit high. Let's go ahead and take it on that other side. 143/72 is much better, and that actually is the affected side. Have you ever had issues with your blood pressure?
No, I haven't.
Okay. It could be unrelated. It also could just be stress. A lot of people do kind of get a little nervous when they come to the doctor's office, so it's not something I'm too worried about.
Okay.
But it might be something that we want to keep an eye on for the next time you come in.
Okay.
Okay, so aside from the blood pressure, I do want to check your blood glucose. This is going to help us just kind of rule out anything that could be related to diabetes. I know you said you're not diabetic and it doesn't run in your family, but it is still important that we get a baseline if that's okay.
That's fine.
Okay, so I'm just going to clean my hands again here, and I will put on a pair of gloves as there is going to be a very, very small blood draw. Do you have a preference which side we take it on?
I guess this hand is fine. This is just a small needle pinprick. It is slightly painful, but it's nothing to really be concerned about. Have you ever had your blood sugar taken before? I think I have.
This is just an alcohol pad. I'm gonna clean your finger. Okay. We're gonna have a small poke here. Very small amount of blood. And I'll just have you hold this on your finger for about 20-30 seconds, and that should be fine. Blood sugar is 125, which is very good. So nothing to be concerned about there.
Good, good.
Check your finger for me. Are you still bleeding?
No, I'm not.
Okay, I'll take that from you. Thank you very much.
Thank you.
We'll just dispose of them, and I'll clean my hands one last time. Alrighty, so everything looked okay with your blood pressure and your blood sugar. Your blood pressure on the unaffected side was a little bit higher than I would like.
Okay.
So we are going to keep an eye on that for the next time you come in. But your blood sugar was great, so I'm not worried about this being related to any kind of diabetes.
Okay, good.
So that's good news. And we're going to go ahead and move forward with the exam if that's okay. Before we get started, I am just going to clean the areas that we're going to be working on, if that's all right.
That's fine.
Okay. So I have some alcohol pads here. And we'll start with this side. I'm just going to do a very light clean. So how old is Bruce? Have you had him for a while?
Yeah, he's about 5 years old.
Wow, okay.
He actually used to be an outside cat, so he's always trying to go outside.
No. Let me see the other side there. That is funny. I have a cat, but they're kind of afraid of the outside. True scaredy cats.
Not him.
Alrighty, it looks like we're good there. Okay, so to get started, we have a bunch of stuff here. Don't let this scare you. I am just gonna grab a tissue to kind of put our used utensils on.
Okay.
We'll start by doing a couple of measurements. I do just want to make sure that there's no swelling on one side or the other. So I'll have you stretch your arms out for me. I'm gonna start by doing just an elbow to wrist here. So we are about 12 and a half.
on the affected. About the same on the affected, which is great. Unaffected, I'm sorry.
Unaffected, right.
And then I'm gonna do across here. We got about 8 inches. I am seeing that this side maybe is a little bit smaller. I'm seeing about 7 3/4. And then lastly, I'm just gonna do around. Okay. And again, I'm seeing that the affected side is actually a little bit more swollen.
Yeah.
Okay. So that's something to keep an eye on. Swelling might be the cause. Let's start off with something simple.
Okay.
This is a liquid sensation test.
Okay.
I do want to do the unaffected arm first, just to kind of get a baseline.
Sure.
So that we know kind of whatever this side is feeling, hypothetically this side should be feeling, and if it's not, then we know we have a deficit, okay?
All right.
So I want you to tell me, I know these look identical. One of these is gonna spray like a mist, and one of these is gonna spray more of like a direct line of water.
Okay.
So I just want you to tell me if it's one way or the other, okay?
Sure. That's more of a mist.
Okay,
Oh yeah, that's a direct line.
perfect, okay. And then let's try the other side.
Okay.
I'm gonna mix these up just so we don't know.
Okay.
Ready?
Straight line.
Okay,
That's the mist.
very good, okay. All right, good job there.
Thank you.
Next, we're gonna move on to the roller. So this is a roller ball. I'm gonna do 2 different tests here. The first one, I just want you to tell me if you can feel it, okay?
Okay. Yes. 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 Yes.
Okay. Now the second time, I want you to tell me if you either feel me press it in or swipe it across. And you can either say press or swipe.
Okay. Press. Swipe. 2 presses. Swipe. Swipe. 2 presses.
Very good, okay. That's just a little bit of lavender oil, it won't hurt you.
Okay.
Let's do the other side.
All right.
So same thing, we're gonna start with the first test. You're just gonna tell me if you can feel it.
Yes, I feel it. Yes. 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 Yes.
Very good.
Yes. Yes. And yes.
Okay. Now we're gonna go for the second test. We're gonna do the press or the swipe. Same thing, okay?
Swipe. Press. Press. Swipe. Press. Swipe. Swipe. Press. Swipe.
Very good. Okay, so it looks like your liquid sensation is doing very well, and I'm assuming when you're taking a shower, you haven't noticed any difference with your ability to
No.
sense the water. You're not having to turn it up more than usual, or
No.
you're not feeling it hotter than you normally would.
No, it's the same.
Okay, very good. And now we're gonna move on to air. So this is just a bulb. You're gonna hear it. Try not to use your auditory senses for this. I really want
Okay.
you to count on feeling that.
All right.
So just as an example, can you feel that?
Yes.
Okay. So I'm gonna move this across your arm, and same thing, you're just gonna tell me if you can feel it or if you can't, okay?
Okay. Yes. 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 Yes.
Okay, I think Bruce is feeling it too. Okay, let's do this side, and it's gonna be the exact same thing, okay?
Okay. Yes. 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 Oh yeah.
Okay, very good. No issues there. So let's move on to something a little more palpable.
Okay.
This is a natural sea sponge. It's not going to hurt you, but it is a little bit scratchy, so you should definitely feel it. If you don't, I want you to let me know.
Okay.
I'm going to do a combination of kind of straight pats and rolls.
All right.
Okay? So initially we'll start with the pats, and I just want you to tell me if you can feel it, and then we'll move on to test number 2, okay? So let's start with your unaffected arm. Let's go ahead and close your eyes for me.
Okay. Yes, I feel it. Yes, I feel it. Yes, I feel it. Yes, I feel it. Yes. 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 Yes.
Okay, and we're gonna move on to test number 2. You did very well, okay?
Thank
So
you.
this is gonna be the press, or it's gonna be a light roll.
Okay. Press. Roll. Roll. Press. Press. Roll. Press. Roll.
Very good. Let's do the other arm. And this is test number 1. I'm just gonna lightly press, and you tell me if you can feel it, okay?
Yes. 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 Yes.
Very good. And then we'll go to test number 2. It's gonna be a press and a roll. You just let me know which one.
All right. A roll. Roll. Press. Roll. Press. Roll. Press. Roll.
Very good. No issues there. Okay, so next we're gonna move on to light touch, and this one's kind of interesting. There's gonna be a 2-part test here. This is just a regular Q-tip. So you're either gonna feel me lightly touch you with it, and I mean lightly, like almost barely, for the first part, and then for the second part, we're gonna do a 1 and a 2 test. So you're either gonna feel me at 1 point or at 2.
Okay.
Okay? So let's start with your unaffected arm.
Yes, I feel it. Yes. 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 Yes.
Very good, and we're gonna move to the 1 or 2, okay?
All right. 1, 2, 1, 2, 2,
Very good.
2, 1, 2, 1, 2.
Very good, no issues there. Same thing, we're gonna do just the light touch first.
Okay. Yes, touch. Touch. Barely, but yes, touch. 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 Barely, but yes, touch.
Okay. Now when you're feeling it here barely, is it that I'm barely touching you, or you feel like your sense is a little bit lighter than it would be normally?
I think the sense is lighter there.
Okay.
Touch. 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 Touch.
Very good. Now we're gonna do the 1 or 2, okay?
All right. 2. 1. I think 1. 2. 1. 2. 2. 1. 1. 1. 2.
Very good.
2. 1. 1. 2.
Okay, very good. So I did notice a little bit of the loss in sensation in this area, like you were
Yeah.
saying. It seems specifically almost over to this very inner part of
Right.
your elbow.
Right.
Okay. Okay, so moving forward, we're gonna go up a step here. This is a very light almost kind of scratchy silicone brush. It's not going to hurt you. It's very, very soft. They're soft bristles. I'm going to do a light stroking motion, and I just want you to tell me if you can feel it, and we'll start with the unaffected arm, okay?
All right. Yes, I feel it. I feel it. I feel it. Yes. 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 Yes.
Very good. Okay, other side.
Yes. 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 And yes.
Perfect. No issues with that one. Very good. Doesn't look like you're having issues with the brushing sensation. Right. It's more so the light touch.
Okay.
So we'll keep that in mind moving forward. We're going to move on. This little device is very interesting. It has two different sides. They look the same, but they're slightly different. So this is going to be a good tell for how well you're feeling, whether something's a little more sharp or slightly less sharp, which can be important if you're touching any kinds of needles or anything that could be dangerous. We don't want it to puncture your skin, so we definitely need to know whether you're aware of sharp or dull, okay?
All right.
So just to give you an example, this is sharp.
Okay.
And this is dull.
Okay.
They're very similar, but there is a slight difference.
Right.
Okay. So let's go ahead and get started, and you're just going to tell me sharp or dull.
Okay. Sharp. Dull. Dull. Sharp.
Very good.
Dull. Dull. Sharp. 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 Dull.
Very good. Okay, let's move on to the other side. You did really well with that.
Okay.
Same thing. It's going to be sharp or dull.
Okay. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay.
Sharp. 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 Dull. Dull. Sharp. Sharp. Sharp.
Okay, very good. So we did have a couple deficits there with the sharp and the dull. You were almost mixing them up, which is interesting.
Oh, wow.
Okay. So let's move forward. This one is very similar. It's also going to be sharp or dull, but the difference is a lot more prominent. So we have a round ball here that's not sharp at all. And then we have a sharp needle point that's a lot more sharp. So you should be able to tell the difference there, okay?
Okay. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. Sharp.
Very good. Okay, other side.
Sharp. Sharp. Dull. Dull.
Okay.
I think it's sharp, but it really feels dull.
Okay.
Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. Sharp.
Interesting. Alrighty, so you did have a couple errors there where you said you maybe thought it was
it was
sharp.
hard to tell. It felt the same. I think
so. It's almost like you feel something, but you
Right.
can't differentiate between the sharp and the dull.
Exactly.
Got it. Okay. So we'll keep that in mind, and we're gonna move on. This one is kind of similar in that it's either going to be one or the other, but neither one of them is sharp. So we have a rounded edge here, and then we have one that's a little bit more squared off. And I want you to tell me if you feel like a roundness or if you feel the corner. So you can either say round or corner or blunt or sharp or whatever you feel. Okay. So let's start with your unaffected side.
Round. Square. Round. Square. Square. Round. square, square.
Very good. Okay, let's move on to the other arm. Same thing.
Round, round, square, square. Hard to tell. I'll say round.
Okay.
Round, round, square, round, square, square, round, round, square, round, square.
Okay, very good. Same thing, it's almost in that same spot that you're having a little bit of that problem, so.
Okay.
Moving forward, and we're kind of going in stages here. I'm sure you've noticed that we're kind of moving up a grade every
Yeah.
time we go, so this one's gonna be a little bit harder. There are two round sides. One of them is just a little bit bigger than the other. So with this one, I want you to tell me if you feel more of it or less of it.
Okay.
Are you able to differentiate between the two there?
Barely.
So this is less,
Okay.
and this one's more.
Okay.
Okay.
So more, less, less, more, less, more, more, less, more, more.
Very good.
Okay.
We'll do the same thing. This side might be a little bit harder, but we're just gonna do the same thing, okay?
Okay. Less, more, less, 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 more,
Okay.
less, less, more, less, more, less, more, less, more.
Very good, okay. So that one you didn't have as many times where you got it wrong. There was maybe one or two, but you did pretty well with that, okay?
Good.
So again, moving up in a scale here, this one is gonna be sharp only, but it's not that sharp. Can you feel that?
Yes.
Okay, so I just want you to tell me if you can feel it or if you can't.
All
Okay.
right. I feel it. Yes. 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 Yes.
Very good. Okay, other side.
Yes. 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 Yes.
Very good, okay. So that one, you got all of them correct, which is
Okay,
great.
Good.
Moving forward, I kind of have a sense now that your unaffected arm is fine. So from now on, we're just gonna test the affected side and kind of try to narrow down on
Okay.
what's going on, okay?
All right.
So if I could just have you stretch this arm out for me.
Sure.
Are you comfortable like that?
Yeah, this is fine.
Okay. So this is similar to the last test, except we're going up a grade in sharpness, okay? So the
Okay.
last one was a little more of a blunted tip. This one is a little bit sharper.
Gotcha.
Okay. So just tell me if you can feel it. This time I'm gonna kind of go in a straight line. I want to gauge a little bit more of exactly where we're having that loss in sensation, okay? So we'll start kind of on the outside of your arm and then I'll move in and then we'll move to the inside.
All right.
Sound good? Can you feel it here?
Yes.
Is that
Yes.
still the same going all the way down?
It does.
No change
Yep.
as we move down here.
No, it feels the same.
Here?
Yep, I feel it. It feels the same. Mm-hmm.
No change?
Nope. Yep. It gets a little weaker right there. It's harder to feel.
Here?
Yeah.
But you can still feel it.
I can feel it. It's just not as strong.
And as we move down,
Yeah, it's the same. Stronger, stronger.
and then stronger as we move down.
Yes.
Okay.
Yep. 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 It's weaker right there.
Here.
Yeah.
Okay.
Yep. And now stronger, stronger, stronger.
And stronger as we move down.
Yes.
Okay. One more.
Okay. Feel it. Feel it. Feel it. Feel it. Feel it. I feel it.
All the way there.
Yes.
Okay, so that side is okay.
Yes.
Perfect. Very good. This one we're gonna be a little more careful because this is our sharpest point.
All
It
right.
is almost a pinprick point, so
Okay.
I don't wanna hurt you, but
Okay.
it is important that we gauge.
Sure.
Can you tell that that's sharper?
Yes, I can.
Okay. Same thing, we're gonna do the outside and we'll kind of move our way in, okay?
All right.
Feel that?
Yep, I feel it.
Feel the same?
Feel it. Yep, feels the same.
Change.
No change.
And you can kind of feel that as I,
Oh yeah.
okay.
Yep, I feel it. Yeah, I feel it. I feel it got a little bit weaker in the middle,
Okay,
right
so
where my elbow bends.
as I go down, tell me to stop when you feel it less.
Right there.
Here.
Yeah,
And tell me to go when you feel it more.
I feel it more. Yep.
So here is less.
Yeah, it's almost like where the crease in my arm is.
Got it. Okay.
Yeah.
So let's do this side.
Okay. Feel it. Feel it. Feel it. A little bit less right there.
Same.
Yeah. Stronger there.
So this side is maybe a little more.
Yeah.
Got it. Okay.
Yep. Feel
Okay.
it. Feel it. Feel it. Feel it.
And that's back
I
to
feel
normal.
it. Yes.
Okay. Alrighty, so got a little bit better of a gauge here. It looks like towards the middle you're having about 2 to 3 inches of loss.
Yeah.
And then when we go over a little bit more to
Yep.
the side, it gets a little bit more gradual as we move down. So it's a little worse on your
Yeah.
very inner side of your arm there.
Exactly.
Okay, so this is a very interesting tool.
Okay.
It's a sharp roller. It's not gonna hurt you, I'm not gonna cut you.
Okay.
It's just gonna kind of roll across your skin, and I just wanted you to tell me if you can feel it going all the way down, okay? So kind of
Okay.
like we just did, but it's a little more of a smooth roll.
Okay. Feel it. Feel it. Yes. Yes.
Okay.
Feel it. I feel it. Feel it. Yes. Feel it. Yeah. I feel it.
No loss there in the middle.
I don't think so. I feel it more with this than the last one.
Okay, good. And normal there as we
Yes,
go down.
it's all normal.
Okay, now with this one, I want to go across this way,
Okay.
and I want you to tell me if you feel it any less as we move out, okay?
I feel it. All right. I feel it. Yeah, it feels a little bit less when you start it.
When I start on this side.
Yeah,
Okay,
like right on there. It doesn't feel as strong.
but you feel it more as
Feel
you
it
kind of go
more on the
around.
outside. Yeah, same thing.
Okay, down here.
I feel it.
So all this is normal
Yeah.
sensation.
I feel all that.
You feel here.
Yes.
Perfect. Okay. So now that we kind of have a little bit of a better gauge of an isolated area, I'm going to use this pinwheel roller.
Okay.
This is kind of twofold. It's also to gauge sensation, but it is going to leave a little bit of a white cast in chalk where we
Okay.
can kind of break off
Okay.
specific areas of what you're feeling and what you're not. And don't worry, this just kind of rubs away, okay?
Okay.
So I'm going to kind of block off, and I want you to tell me again with the stop and go where you feel it more and where you don't. So we're going to go down and we're going to kind of box it off, okay?
Okay.
So here or further in?
Further in. Back a little bit. Yeah, right there.
Here?
Yeah.
Up higher or down lower?
Down right there. Down a little bit. Yes, right
Starting here?
there. Yes.
Okay, so tell me when to stop from this point.
Stop.
You start to gain sensation
Yes.
after that. Okay,
Yes.
so let me just darken that up a little bit. And then we'll do the same thing over here.
Okay. I feel it.
Is
I
that
feel
too
it.
far out? Is it more this way?
Yeah. Right there.
Here?
Yes.
Okay, so same thing. Tell me when to stop.
Stop. Stop. Yeah.
Okay, and then as we go across, I assume this is,
Yeah.
so this area here.
Yes. Yes.
That's exactly where it's at.
Yes.
Very good. Okay, let me just darken that up for you a little bit. Okay, very good. So now we have an isolated area. So I want to go back to these two very different sensations here. We have the very, very light and the sharpest sharp that we tested, okay?
Okay.
So just to remind you, this was the light and this was the sharp.
Okay.
So for this one, we're gonna go straight into the light or sharp. It is really important that we gauge whether you can differentiate between the two. Say you're like on a hike or something and a tree hits you. We wanna know that you can feel when something is dangerous or when it's not, okay? So if something's, you know, not dangerous, or if your cat scratches you and you're bleeding, you kind of need to know the difference, okay?
Okay.
So just close your eyes for me and let me know what you feel.
Feel light. 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 It's a little bit heavier, but it's still light.
Okay.
I guess that's the sharper one.
Okay.
Yeah, it's sharper, but it still feels light.
Got it, okay. So maybe not as sharp as you would feel it here.
Right,
Got
right.
it. Okay. Alrighty, so keeping that in mind, I want to move on to something that's going to be either hot or cold.
Okay.
And when I say hot or cold, it's not going to be like burning or freezing.
Okay.
But there is a significant difference in temperature between these two.
All right.
So just to give you a little bit of an example here, this one is going to be hot.
Oh, okay.
And this one is cold. So it's more of like a warm and, you know?
I gotcha.
So I am going to do this on your whole arm on your affected side and then specifically in that isolated area. Okay. So just let me know what you feel here.
All right. Feels cold. Feels warm. Feels warm. Feels cold. Feels cold. Feels warm. Feels cold. Feels warm. 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 Colder.
Very good. So on other areas of your affected arm, there doesn't seem to be a deficit with temperature. So now we are going to test specifically in that area. Okay.
It feels colder. It feels colder, yes.
Okay.
Colder. Warmer. Warm. Colder. Warmer. Warmer. Colder.
Okay.
Colder. Warmer.
Okay, now is this colder the same as this colder?
No, it's not. It's not as cold.
Is this colder the same as this colder?
No.
And is this warmer the same as this warmer?
The warm feels the same, but the cold feels less cold.
Got it. So the cold maybe is more room temp.
Yeah, exactly.
And the warm is warm regardless.
Right.
Okay. Well, the good news there is you're more likely to come in contact with something that's too hot than with something that's too cold.
Okay,
so it is good that you are able to sense the warm regardless, but I am a little bit concerned about that lack of cold sensation because, you know, again, if you're out in nature and it's too cold or depending on where you live,
right.
Our office here is in Philadelphia, so we do get kind of, you know, crazy winters. We want you to be able to tell between what's cold and what's not. So that's something to keep an eye out for.
All right.
The last part of our sensation test here is going to be 2 different kinds of brush strokes.
All right.
I do want to be a little bit careful with this because if for whatever reason this is neuropathy, brush strokes can be a little bit painful.
Okay.
So we're going to test this kind of slowly, and I'm going to start with the softer brush here.
Okay.
The interesting thing with neuropathy is that when you touch something with a brush stroke, but it's like a patting motion, it doesn't hurt.
Right.
But when you do like a swiping motion, it can be an instant painful sensation.
Okay.
So we're going to go kind of slow. Let me know if this versus this in that affected area makes any difference. And if it's painful, let me know and we'll stop, okay?
Okay.
So can you tell that this one is soft and this one is a lot harder?
Yeah, I can.
Okay. So at very first, I want you to just tell me if you feel it, okay?
Okay. I feel it. I feel it. I feel it. I feel it. Yes. 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 Yes.
Okay. And now we're going to do the more wiry brush. Same thing. I'm just going to pat it. Just tell me if you feel it, okay?
Okay. Yes. 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 Yes.
Okay, very good. Now we're gonna move to the affected area. So far, I'm not doing any swiping or brushing motions. I just wanna pat it and you tell me if you feel it.
I feel it. I feel it. I feel it.
Now I want you to tell me if you feel the soft or the wiry brush. You can say soft or sharp or whatever is more comfortable for you.
Okay. Softer. Sharper. Sharper. Softer.
Okay, very good. Now we're gonna move on to the brushing strokes, okay?
Okay.
Like I said, if this is painful, I do want you to let me know.
All right.
So we're gonna start with the soft brush first.
Okay, I feel it. I feel it.
No pain so far.
No, no pain. No. 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 No.
Okay, and we're moving on to the wiry brush, same
Okay.
thing.
Okay, I feel it. No pain. No. No pain. No pain. No pain. No. No pain. No pain. No pain. No pain. No pain.
Okay. I'm gonna do that in the affected area now, so just let me know if that changes, okay?
Okay. No, no pain. No, there's no pain. No. No, it's okay.
Okay, very good. So it doesn't look like the issue is neuropathy, which is
Okay.
really good. We've kind of
Good.
ruled that out, okay?
Yes.
So let me just get a little bit of the sanitizer and I'll go ahead and rub that chalk off for you.
All right, thank you.
Okay. All right, Julio, so I'm just gonna take a couple of notes down here.
Okay.
Like I said, it doesn't look like it's neuropathy, which is very, very good. So we don't have to worry about that.
Okay.
Your blood glucose was 125, which is perfectly normal.
Okay.
And like I said, your blood pressure was a little bit high on your unaffected arm. So I do maybe want you to double check with your cardiologist on that. Do you have a cardiologist that you see regularly?
No, I don't.
You don't, okay. So that is someone that I can refer you to, no worries. I will write you a prescription to see a cardiologist. Maybe get an EKG done just to kind of double check on what's going on with that. But your
Okay.
unaffected blood pressure was great.
All right, good.
Okay. Issues with loss of pinprick. No polyneuropathy. With brushing. Loss of sensation. Inner elbow. Increased with lack of sleep. All right, Julio.
All right.
Well, I am gonna send this referral over to our receptionist.
Okay.
There's going to be 2 referrals. It's going to be one for you to see the cardiologist and just follow up with them whenever you can. It's not emergent, but it is something that I think would be a good idea.
Okay.
And then the second referral is going to be for you to see our cranial nerve specialist.
Okay.
The reason that I want you to see her is because I do think that there is something going on with your cranial nerves, specifically your loss of sensation.
Yeah.
It looks like there might be some kind of deficit going on the inside of your arm, and I'm just not sure exactly what it is because it doesn't seem to be diabetes and it doesn't seem to be neuropathy. You do need to follow up so we can make sure that you don't have any major arteries that are being affected or none of your blood vessels are blocked.
Okay.
So I will write you that prescription, and that one is a little more necessary, so I would follow up with her as soon as you can, okay? But other than
Okay.
that, do you have any questions?
No, I think that's everything. Thank you so much.
Okay, no problem. It was very nice to meet you, and Bruce, you guys take care.
All right, we will. Thank you.